Okay, so today we're going to talk about music therapy in pediatric burn recovery. So, an introduction, um, what we know about burn recovery is according to the National Safe Kids campaign, burn injuries are the fourth most common cause of accidental death in children and adults. So, it's a lot more common than we actually would think it would be. The same organization, the NSKC, also shows that infants and toddlers are most susceptible to bathtub scalds or kitchen-related accidents. And other causes could include playing with matches, fireworks, barbecues, or fireplaces. So these type of burns can happen in everyday activities, in the home, and they tend to be more common and can be very severe. So it's important to be aware of them. The healthcare team involved with burn care is the general surgery, anesthesiologist, nursing, respiratory therapy, occupational and physical therapy, nutrition, social work, care coordination, psychology, psychiatry, and music therapy. So the overview of music therapy services. It's offered in both inpatient and outpatient situations for individuals in recovery. So again, depending on the level of severity of the burn and what stage they're in as far as their recovery, music therapy is offered in all cases. The assessment process includes cultural considerations, which allows for sessions in patients' own language. This is crucial because we get a lot of patients in burn recovery that are coming from many different cultural backgrounds, ethnicities, and they speak different languages. And so it's important to make sure that the sessions are intimate and able to connect with the patient where they're at. Length of stay is dependent on the severity of the burn, and referrals usually come verbally from physicians, nurses, psychologists, case coordinators, and occupational physical therapists. So it's similar to other patients that might be in medical facilities as far as the referral process. The music therapist is an active part of the interdisciplinary team and can recommend services to patients from information given in the meetings. So the music therapist can also recommend that their services be provided to a patient simply by gaining information about that patient in the IDT meetings. So as we continue the overview, when we talk about referral criteria for pediatric burn patients, we're talking about inability to effectively cope with pain and anxiety, experiencing emotional withdrawal, need for neurological or development stimulation, reinforcement of active and functional range of motion, increasing patient motivation for active participation, and improving positive patient-parent-child interaction. So all of these factors are really important as far as the referral process. What is the need of the patient, and do they have a deficit in any one of these areas that could be improved by music therapy? Music therapy incorporates a family-centered approach to care at each stage of recovery. So we're going to go over these three stages now in burn recovery, but it's important to remember that the music therapist is always focused on the family first throughout the recovery process. So the three phases in burn recovery are acute phase, rehabilitation, and reconstructive. So first we're going to talk about acute. So the acute phase is the beginning phase of recovery and happens directly after a burn injury. So the body is starting to adapt to the injury, and patients are at a high risk of shock and edema. Shock being simply from the fact of their body is reacting to something that is very foreign and all of a sudden has happened to their body. So they're in a state of shock, and this can potentially cause organ failure and other long-term injuries. And so it's important to really start the recovery process as soon as possible. Inhalation injuries can also occur, and this could lead to mechanical ventilation. Mechanical ventilation is a machine that helps people to breathe when they are incapable to breathe on their own. And edema, I'm sorry I didn't mention before, edema is a condition where an excess of fluid is built up in tissues within the body. So this is where, kind of like, I suppose it's similar to internal bleeding, where you have a lot of fluids that start to form inside the body into tissues and can cause damage to those organs or tissues. But moving on, the larger the burn injury, the greater the risk of mortality. So this is important to nail quickly and to start the recovery process, because if the burn is severe and in a large area, it can lead to death. It may include numerous operative procedures, and surgery procedures include debridement and excision of dead tissue, wound closures through skin, grafting, and sometimes amputation of limbs or digits. So the surgery can be pretty severe and pretty life-changing, and cause quite a bit of anxiety and pain for the patient. So as we move on, in the acute phase, when we talk about skin grafts, what are we talking about? Well, we're talking about the autograft, which is a patient's own skin. So skin is removed from another part of the patient's body and placed over and surgically attached to the wound area. Homograft, which is a tissue from cadavers, so tissue from dead bodies that can be transplanted onto the patient. Cultured skin, which is skin grown in a laboratory. And artificial skin substitutes, so this is temporary coverings. So all of these are forms of grafts depending on the need of the patient that can be done to help the wound heal. Nutrition may sometimes be provided through nasogastric tubes. Nasogastric tubes are tubes that send nutrients and medicine to the stomach through the nose. So if a patient can't breathe normally through their mouth, eat normally through their mouth, they can get nutrition through these nasogastric tubes. The body can enter a hypermetabolic state, which causes significant increase in in energy expenditure and accelerated metabolism. And then a level of consciousness can vary from patient to patient. So this is where the patient's starting to become a little bit more aware of their injury, and it can be very effective on them in a negative way. And when we talk about pain modification, pain is a subjective experience for each patient, which includes sensory, emotional, and cognitive components. This is important to remember that pain is not something that is completely objective, that's absolute, that everybody experiences the same way. It's subjective, which means that different people are going to have different sensitivities to pain, and it's important to take that into consideration as a music therapist when you're working with a patient. Several clinical studies have found music to be effective in pain reduction. Music listening has been shown to have positive effects on coping and pain reduction, and reduce the need for a higher dosage of medication or sedation in post-operative procedures. So simply the fact of music listening as an intervention can help reduce the pain coming out of an operation, and also learning how to cope on their own when they have to go through these type of procedures. Pain modification can reduce any long-term psychological effects or potential symptoms, for PTSD. Music can also be used as a supplemental treatment for pain by targeting psychological and cognitive components in inhibiting mechanisms that worsen pain perception. And we'll talk a little bit about this more later too, but the fact of the matter is that music can really cause a positive distraction from the psychological fears and anxieties that come with going into a surgery and coming out of one. It really helps to kind of lessen that anxiety and thereby lessen the pain or perception of how much pain that the patient might be feeling. So as we move on, music therapy assessment for pediatric burn victims. The MT should always review the chart of the patient attending to the cause of the burn, location of the wound, and psychosocial concerns. So those are the three major areas that the music therapist should always look at in the chart. Establish a positive relationship with patient's parents or guardian. Gather information about history and previous hospital experiences. Assess the child's coping responses to pain and stress, play activities and musical interests and experiences. Assess response to pain and coping strategies. Assess family coping interaction style with the child. And reassess throughout phases of the treatment. So this process of assessment is constant and ongoing throughout all the phases of treatment. Never really stops. You're always working with the patient to try and improve pain and coping strategies, but you're also assessing each time where they're at. Is there any improvement? Is there some digression? Is there stagnancy? And can you work with those things? So for music therapy application, sessions always occur at the bedside. I shouldn't say always. They usually occur at the bedside. Music therapy should always model behavior and promote appropriate response and interaction between families and patient. They actively include family members in session to increase coping responses. So again, the idea is to constantly improve that rapport and connection between family members and the patient. Burn pain should be assessed in two different categories, background and procedural. So background pain is pain that the child is experiencing continuously while they're at rest. So it's an ongoing pain, physical pain in their body. Procedural pain is pain associated with a medical procedure and treatments. So they just had an operation, they're coming out of it, and there's soreness or pain related to that procedure. That would be procedural. And all of this assessment includes intensity, heart rate, respiratory rate, blood pressure, mood, affect, and activity level. So these are all things that the music therapist is looking at. So when we're also continuing to talk about application, the music therapist should observe patients' ability to engage in activities to gain insight on coping and pain tolerance for the patient. They should monitor parent-guardian coping strategies and how this can impact the patient, how the patient is responding to situations. So always being aware of how the patient is responding and how the parents respond as well, and that they can have an effect on each other. Music therapy can supplement medication to enhance coping skills and increase positive affect for the child. It can provide a distraction from painful symptoms or the burn area, and increased attention to pain can increase perception of pain intensity in the patient. So what are some techniques that we're talking about? Usually, domain-wise, we're talking about emotional and cognitive. A great focus is the active music engagement. This provides structure, autonomy, and involvement. These are three very important components in the treatment process for burn victims, especially children and pediatrics. So, active music engagement, getting them involved with playing an instrument, getting involved participating in singing, and just being active in the whole process. Choice is huge, and we talked about autonomy and control. The music therapist should offer simple choices between two things to distinguish decision-making skills for the child. So you're assessing, again, how well does the child make decisions. Giving them simple, clear directions is a good way to do that. Emotional concerns can come from traumatic experiences, and music can help offer structure and creative expression to help them cope with trauma. So treatment goals during this acute phase, you want to foster coping skills related to trauma, pain, and anxiety. You're facilitating positive family interactions. You're promoting emotional expression. Reinforce physical rehabilitation. Provide normal, positive, and pleasant experiences. Provide opportunities for choice and control. And increase child's ability to participate in and attend to music activities. And all of these can really be faced with the music interventions that we talked about, especially active music engagement, can really help with a lot of these goals. So now we're going to talk about the rehabilitation phase. This is the most rigorous therapy phase for them physically. A lot of this is in terms of trying to get their body back into kind of normal mode. So range of motion exercises, scar massage, splinting are common techniques used to prevent orthopedic complications. During this phase, the patient has a demanding schedule of treatments. So lots of treatments, lots of people coming in all the time to have them do treatment and procedures. And the hospital routine can be overwhelming and stressful for everybody involved. So when we're talking about treatment, it includes pharmacological therapy and behavioral cognitive therapy. So again, we're dealing with the psychological, the emotional, as well as the medical side and drugs to help with the pain. Assessment for pain anxiety should include observational data before, during, and after rehabilitation sessions. Music therapy interventions can help with coping, establishing a routine, and supplement their typical pain management schedule. Treatment goals include reinforcing active exercise, functional range of motion, improving pain and anxiety, and providing a positive outlet to express feelings. And some of these interventions are songwriting, improvisation, active music engagement, developmental music play, and music-assisted relaxation. So the physiological changes here, we have metabolic changes. This can cause loss of muscle mass, weakness in bone density, osteoporosis, lowered endurance. So patient goals are established with the family during IDT meetings prior to the patient starting the treatment program. And studies have shown that music and rhythm can improve gait and muscular control. Music has also been shown to increase endurance in cardiovascular exercises and enhance mood. So music with children, participation and compliance can be difficult due to the inability to comprehend the scope of their own treatment. So they're going through a lot right now, and it can be difficult, and the desire to participate for them can be very low. Group sessions can be really helpful, though, because they provide opportunities to practice social skills, including cooperation, and they get a chance to play with people their own age and interact with those their own age. Music has been shown to enhance cognitive and social skills in pediatrics by sustaining attention and increasing the participation. Group sessions can also create structure, movement, and develop appropriate activities to help children with the rehabilitation process. Opening songs are great to kind of get the body warmed up, and musical games are another great way to kind of work on fine and gross motor skills. And a specific type of music therapy that's big with pediatric burn patients is neurological music therapy. Two techniques serve as primary interventions within this form of therapy: pattern sensory enhancement and therapeutic intervention music performance, which is known as TEMP. PSE is a rhythmic, melodic, harmonic and dynamic acoustical elements of music that provide temporal and spatial cues for music related to daily living. And then temp is playing the instruments in order to stimulate and exercise functional movement. So you can think of temp as more kind of like an active music engagement, where they're actually involved with playing instruments to help with movement, whereas PSE is more of other forms of music interventions that just get more participation and involvement, dealing with coping strategies. Live music is the most preferred, but recorded music has also been effective. Individualized music therapy is offered based on the child's needs, And the music therapist should work closely with the IDT, as we've talked about before. It's always important. Treatment goals. So we're reinforcing active exercises and range of motion. We're managing pain and anxiety, promoting adjustment to injury and hospitalization, encouraging a positive outlet for expression of feelings, increasing motivation and compliance in recovery, providing developmental and neurological stimulation, enhancing caregiver to child interaction, and providing normalized experiences through music and play. So all of these are really helpful in getting that range of motion back and more movement in the rehabilitation process. So now we're going to talk about the reconstructive phase. This is, again, active and range of motion exercises that are continuing as the body begins to heal. Sometimes at this stage, pressure garments need to be worn to help to prevent scarring and flattering skin. Face masks, plastic surgery is sometimes needed. And children can be at risk for depression, PTSD, body image dissatisfaction, and difficulties with social and occupational functioning. Emotional-wise, there's feelings of helplessness, disruption of family life, behavioral regression, and increased emotional distress. So, music therapy services are here to address hospitalization and body image, self-concept, and developmental growth at this stage. Relaxation, music-assisted relaxation is a great way to be effective in relieving anxiety for burn patients who are undergoing these heavy surgical procedures. Songwriting and improvisation are also useful in post-surgery because they can support that autonomy, structure, and involvement that we talked about earlier when the patient is experiencing decreased mobility. And I didn't mention before, but it also, emotional-wise, songwriting can also help to validate and express the feelings that they may have a difficulty in sharing. So music therapy referrals, these occurred due to the reinforcement of range of motion, pain and anxiety, self-expression, social interaction, and mastery of their environment. So it's about that autonomy, that control. These are some needs that require music therapy referrals. The music therapist may meet with the patient 15 to 20 minutes prior to a procedure and then work with that patient in a continual basis before, during, and after. Active music engagement, self-expression, social interaction, and mastery of environment are all good goals in this phase. Temp is the most commonly used technique in this phase. So with temp, remember, you're getting the patient involved with actually playing the instrument and working on their range of motion. And this helps to regain their functional independence and fine motor dexterity as well. Active music making can be so beneficial, especially for adolescents. Learning how to play an instrument can really help motivate and exercise their fingers and arms. So it's a really great tool to use. The role of the music therapist, you really want to maximize physical skills. You're fostering the patient's path to acceptance through emotional support, encouragement, and accomplishments. Remember, the sessions can provide music experiences that allow the patient to express thoughts and feelings within a safe, supportive environment. And group sessions can be great because they can offer emotional support and social interaction, this kind of sense of solidarity between patients in the hospital. Peer interaction is vital to their growth and adjustment process as they get back to their normal lives. And then as these curtains open up, there we go. And then finally, we'll talk about the treatment goals for the reconstructive phase. And these are encouraging positive body image and self-concept, facilitating coping skills with preoperative anxiety, support quality of life, provide stimulation for developmental growth, facilitate expression and validate feelings of positive emotional adjustment, provide procedural support, reinforce post-surgery range of motion and functional movement, promote social interaction and mastery over the environment, facilitate pain management, and foster support among patients and families. So again, throughout all these phases, I think the main thing that we're looking at when we talk about pediatric burn patients and the music therapy process of treatment goals and interventions is, we're looking at autonomy, we're looking at patient involvement and emotional experiences. All of those things are, and structure. All of those things are vital to really help them get back to a normal life and a normal sense of well-being. So that concludes my presentation. Thank you very much. There, songwriting and music video productions can also be helpful to promote emotional well-being, especially with adolescents. Rapport building through music, such as egg shaker passes and group drumming or drum circles, can be effective for social interaction and cohesion. And then writing a song about an injury as a group can be great for developing coping responses through the sharing of insights. And again, that sense of solidarity and universality, that you're not alone, that there are others who are sharing in your experiences and concerns.